Thank you and good afternoon. So this is our update for May 28th on the COVID-19 cases here in British Columbia, and we have 9 new people who have tested positive in the last 24 hours, bringing our total here in British Columbia to 2,558 people. That includes 899 people in Vancouver Coastal Health Region, 1,274 people in the Fraser Health Region, 127 people in the Vancouver Island Health Region, 195 people in the Interior Health Region, and 63 people in the Northern Health Region. We unfortunately have one new healthcare related outbreak in a long-term care home in the Fraser Health Region in Nicola Lodge, with a single case so far, and I know Fraser Health are actively working with the home to ensure that we contain this as quickly as possible. There are now 16 active outbreaks in our healthcare system, including 15 in long-term care or assisted living and 1 in acute care, and that includes 550 cases, 338 residents, and 212 staff involved in those outbreaks. On the positive side, we have no new community outbreaks, and I'm really pleased to say that today the outbreak at the Mission Federal Correctional Facility has now been declared over as of yesterday, which means we have no new cases for 2 incubation periods. And as you know, that is one of the largest outbreaks we've had in the province, and it took an incredible effort. And I really want to commend the teams from Fraser Health in particular, from BC-CDC who supported them, from the Mobile Medical Unit, but the immense effort that people put into ensuring that people in that correctional facility had access to what they needed to control this outbreak and were cared for and supported through this last very difficult number of weeks. It required a lot of coordination as well with our federal partners, especially Correctional Services Canada and the Public Health Agency of Canada, and the protocols that were developed have really been now expanded and put in place in federal correctional institutions across the country. And I think that's a real testament to the amount of effort and expertise that we have in the province to support this type of outbreak response. We have 241 active cases across the province right now. Of those, 33 people are in hospital and 6 people are now currently in critical care or ICU. Unfortunately, we have also had 2 new deaths in the last day, both of them in long-term care in Fraser Health. And I know how challenging the situation is in long-term care when our elders and seniors are afflicted with this virus. And our condolences go to the care teams who are trying so hard to support people, to the families, and to the communities who love these people. We now have 2,153 people who are fully recovered from COVID-19. As you know, we are in our restart, and we're a little after 1 week in our restart program. And as we know, COVID-19 has a 2-week incubation period. And we know as well, we have learned that the virus can be passed on from someone who is asymptomatic or early on in their symptoms or has mild symptoms and may not realize that they are ill. We are carefully moving forward into this phase 2, into our restart, and we are watching for new cases closely and are assessing our progress week by week. And we're doing that through our testing, through our contact tracing, through making sure that we're managing all of the outbreaks and the cases. We need to get comfortable with our phase 2 before progressing further. And as things are progressing in the last week, we've seen that. We are becoming more comfortable with our social interactions, how this looks and how this feels. Businesses are reopening. And next week, in another major important event, in-class schooling will start again in many parts for many children across the province. And as we know, that will be a mixture of in-class and at home with smaller numbers. It will look different than when school let up in March. We have a good understanding of how we're doing. We will have a good understanding of how we are doing around mid-June, when we've had these couple of incubation periods. We'll have the data that we need to determine our timing for the further actions. And our slow and thoughtful approach will continue, as that is our new normal. It's grounded in what we know about this virus today and will continue to be adapted as we learn more about this virus in the coming months. And that is how we're going to make it through this phase, through our summer, and should we need to, how we will be looking at this into the fall. I also want to say that I have updated one of the PHO orders on vending markets, and that was published today. So vending markets are what we commonly know as our farmers markets, and as you know, we had some restrictions on those. And this new revision of the order removes the prohibition on selling merchandise, so any non-food items. So that will be, I think, in keeping with our opening up of retail stores, it's appropriate that we now are able to have non-food items at our farmers markets. As well, eating at tables will be allowed in a similar way to how we have restrictions around pubs and restaurants. So it'll be small numbers and spaced apart. But I think that's an important thing as well, because we know how important it is to have these community places where we can buy fresh food and where we can have access to some of the local crafts and arts. I also want to talk today for a minute about the impact of COVID-19 on the overdose crises, our other public health emergency that continues here in British Columbia. Yesterday, the Coroner's Service reported once again a notable and very disheartening increase in illicit drug toxicity deaths. We had 117 people who died in April from an illicit drug overdose. These are our family. These are our community members. They're mostly our sons, our nephews, our cousins, our brothers and sisters. Most of them are between the ages of 20 and 50. So these are young people. These are our young men, more than women, in our society. And we know that most of them are dying alone. And part of that is because of the challenges that they face around admitting that they are using drugs and getting the supports that they need. We know there is stigma associated with people who use drugs, and that is one of the things that we need to overcome. We also know for those who are facing things like homelessness and mental health and substance use disorder, COVID-19 and all of the measures that we've had in place to stop this virus is an added challenge. I want people in British Columbia to know that while I stand up here most days sharing the information that we have around COVID-19, we also are mindful of this other public health crisis that continues unabated in our province. And we are working hard to ensure that we continue to address that emergency as well. There is a lot of work being done to support the emergency, and people are not forgotten. We know that we need to continue our activities to ensure that there's access to a safer supply of drugs. We know the toxicity of the street drugs in British Columbia and across North America right now has increased. And we know that the situations that we're in and the anxieties and the challenges that we're facing with physical distancing, with challenges with access to food security, these are things that make the situation even worse for people who are using drugs. It is a complex problem, as I have said many times, and there are many pieces that need to go into the solution. And we have not forgotten that, and we continue to push. I also want to just mention that we continue to have access to our survey, the province-wide survey, Your Story, Our Future, and I encourage everybody to take part in that. Over 330,000 people have completed the survey so far, but we have several more days to go, so please do look at that. And I do want to thank the BC CDC Foundation for Public Health. It is the philanthropic arm, if you will, of the BC CDC, and much of the support for some of the important public health research, including this survey, has come from that foundation and partner with that foundation. We all want to get back to what we know we have in British Columbia, healthy, vibrant, and safe communities. By working together and supporting each other in kindness and in care, we will make that happen. So let's continue to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry. I want to join Dr. Henry on behalf of the Premier, on behalf of the province, in expressing our condolences to the 2 people who passed away in long-term care in Fraser Health in the last 24-hour reporting period. I think it continues to be a difficult thing. I hear from people every day about how challenging it is for those working in long-term care, and I'm going to have more to say about that in a moment, but also for family members in these very, very challenging times. And so we want to express our condolences, our solidarity with the sorrow of people who have lost loved ones to COVID-19, and we are going to continue to do everything we can to limit transmission of COVID-19 in British Columbia. I wanted to also note, as Dr. Henry did, the report of the coroner yesterday, 117 overdose deaths this month, 114 last month, is 117 and 114 too many. And we have to continue our efforts, particularly in these times. And you've seen some extraordinary efforts, especially those led by community organizations, led by health authorities in recent months to try and address this situation. And we're going to continue to work on this together, because it is our other health emergency, or COVID-19 is our other health emergency. There are 2 health emergencies, and those 117 people and their families would also like to express my condolences and my sense of sorrow with them today at the loss of their loved ones. As Dr. Henry has said, we have 33 people hospitalized with COVID-19 today. That's down 4 from yesterday's report. We have 6 in critical care. That's down 7. To put it in context, we're over 5,000 emergency room visits yesterday, 5,141. So people are, again, continuing to use emergency rooms, and dramatically, as we spoke about yesterday, and significantly using urgent and primary care centers in BC, and they have done in record numbers during the period of COVID-19, and we're very grateful to all those working in those in our 17 urgent and primary care centers across the province, be they pharmacists, be they nurses, be they doctors, be they counselors, be they social workers, be they medical office administrators, or many others who do an extraordinary job every day in our UPCCs and have really delivered at a time when people really needed their help. So I want to express my appreciation to them. As well, I wanted to note that the overall occupancy in hospitals is up to 70%, and occupancy in ICUs is up to 52.5%. I want to acknowledge the changes that Dr. Henry has talked about for farmers markets. I want to acknowledge my colleague in the legislature, Norm Letnick, my colleague in the cabinet, Minister of Agriculture, Lana Popham, who know these areas very well and have communicated with us both the concerns and the aspirations of people to be safe while going to farmers markets in BC. So I wanted to thank them as well. I'm going to just give 2 updates that I'm now giving on Thursday. The first is about the single site staffing initiative, that update, and then one about surgeries. I want to start the single site initiative update with a correction. The total number of sites identified has been adjusted downward from 545 to 533, so that's 12 less. This change results from a determination there was some double counting of some sites where, for example, there was assisted living and long-term care on a single site. And so the adjustment also impacts the number of sites with completed plans, which moves from 497 from 499. Accordingly, we have 533 facilities hosting multiple facility employees going into this change, with a total of 7,350 employees who worked at multiple facilities. Here's where we stand now. Of the 533 facilities, 497, essentially the same as last week, have completed their single site plan. That's 121 in Interior Health, 141 in Fraser Health, 94 in Vancouver Coastal Health, 106 in Island Health, and 35 in Northern Health. We don't, of course, make progress or talk about the 36 sites where it's not filled, but there is movement in all 36 of those sites. The majority of those 36 remaining sites are assisted living sites. And the ministry continues to work with health authorities to gather detailed information on current compensation from the non-Health Employer Association of BC sites. That's an important question. As you know, we are raising up salaries to ensure that workers support and are part of this initiative. This is a significant difference between the single site initiative in British Columbia and other jurisdictions who are attempting the same thing. It's a fundamental reason for our success. To support this work, the Ministry has worked with legal services, health authorities, and industry partners to develop a provincial template and process. We held a webinar on May 26th with 250 participants and a second webinar in the coming days to ensure all organizations can hear the presentation and raise questions and concerns. The money, and will be retroactive to the single site order, but the additional money and support of healthcare workers will come in the middle of June, but it'll be retroactive, so people will get their full compensation, those that will see their wages rise under the single site initiative. And so I wanted to express my appreciation to everyone involved in the process. I wanted to note that the work in long-term care in BC has been challenging as it is everywhere else, and there's been talk about it a lot in the national discussion in the last few days. And I am, of course, saddened that we've lost 93 people, residents who live in long-term care. It is a blow to everyone, especially those who work with them, who provide care with them, and of course their families, and of course their communities. I think that British Columbia, though, can be proud of its long-term care workers, of its long-term care facilities. We've adopted, from the beginning, a Team BC approach to how we deal with this issue. We've, from the very first days, and I'll recall, Dr. Henry will recall, because for us, preparing for the briefing that day, the first day that an outbreak was reported at the Lynn Valley Care Home was an extraordinarily emotional day for us, because we understood from the information we'd received from Hubei province and other things, the vulnerability of people living in long-term care. And that vulnerability has been shown everywhere in the world. But in BC, because we've worked together, because of the extraordinary work of medical health officers like Dr. Patricia Daly in Vancouver Coastal Health, we have, in many respects, had a better situation. Certainly our 93 deaths compared to thousands in other places demonstrates that. And the things that we've done together, and I mean unions and the BC care providers and the denominational health associations and health authorities working together. It means in BC we were the first in Canada to ensure that long-term care homes that were not health authority owned and operated were integrated into the supply chain for PPE, which is a critical factor in British Columbia in controlling the spread of the infection. Of course, the challenge of restricting visits, which was put in place. The actions of our rapid response team, this extraordinary work of infection control specialists across the system, people who work for health authorities and have devoted themselves to this work. The single site initiative, which I think is significant and transformative to the quality of care. The support that we've given to the care providers and denominational health, for example, to invest in infection control materials, the $10 million that happened in March, early on in the process, to start to address gaps in the system. And of course, the move to increase care standards that started in 2017, the move to ensure that healthcare workers were treated fairly with Bill 47 passed unanimously in the legislature. We are going to continue on this path together in BC, a Team BC approach that involves everyone, that recognizes the quality of all of the people involved. And so we are delighted, of course, that other levels of government, that the federal government is interested in this, and we are going to focus on continuing to improve access in the system, including the need to rebuild long-term care facilities that are older in BC to modern standards, the need to have a plan to improve health, human resources, and the number of people working in long-term care, which we are going to need in the future, a new generation of healthcare workers. So we are encouraged to involve everybody in a serious, focused, practical effort to improve the lives of residents and to improve the work of workers in long-term care. That's what should be important right now, and that's what we're committed to do, and I'm so proud of all our teams and all the work that they've done. I want to also update you on progress on surgery. On March 16th, as you know, we delayed all non-urgent elective surgeries, or what I prefer to call scheduled surgeries. Our estimate of the total number of surgeries postponed in the 2-month period which followed was approximately 30,000. As you know, we continue to provide urgent scheduled surgeries and emergency or emergent surgeries in that time. From March 16th to May 17th, doctors, nurses, and healthcare workers completed 23,385 such surgeries, or approximately 2,600 a week. This week, the number of completed surgeries is 27,349. That's an increase of 3,817. That's significant. And we are continuing to work and to build on this week unto week unto week. On May 7th, we announced our commitment to surgery renewal that had been postponed due to COVID-19. It takes time to schedule patients. I wanted to say that we continue to make progress on this. By May 13th, 6,884 people across BC had been contacted by staff to discuss rescheduling their surgeries. That number is increased to 12,016. By May 17th, we have now contacted 17,978 patients, an increase of a further almost 6,000 from May 17th. All of this progress represents an extraordinary achievement by our surgeons, our nurses, our healthcare workers, and our health sciences professionals, and we are grateful to each and every one of them. To me, it's clear that everyone involved in providing the same energy and helping people waiting for surgeries as we provided in our response to COVID-19 is a fundamental commitment. It's also clear that everyone involved needs to do what they need to do in the operating room. For them to do that, we need to ensure we're doing what we need to do to prevent a resurgence of COVID-19. Our target timelines are clear. On May 31st, we want all contracted private surgical facilities working at maximum capacity. And by June 15th, all existing operating rooms running at full capacity. From June 15th to October 15th, we will add resources and capacity by extending daily hours of operation, adding Saturdays and Sundays to the schedule, and opening new operating rooms. We will remain focused on caring for those patients who need surgery most, and on patients it is the safest to care for. Our surgery renewal commitment is our commitment to patients, and it is available on the Ministry of Health webpage. The progress we've made and the plan itself shows the commitment to surgical renewal means to all of us. It also shows the commitment surgery renewal requires from each of us, of how much depends on each of us continuing to stay 100% committed to what Dr. Henry and our medical health officers have asked us to do. A surge in new cases or a second wave this fall will put our progress at risk. So I'd ask all of us to consider the power each of us has, each and every day to shape our BC experience with COVID-19, and the power each and every one of us has to fulfill our surgery renewal commitment. It is a tremendous power, one that is anchored in staying 100% all in an effort to stop the spread.